Bismillahirrahmanirrahim. My name is Dr. Shahzad Irfan. I'm going to present my oral presentation in the third International Conference on Applied Zoology, which will be held on 7th to 8th December 2020 virtually. The topic or the title of my presentation is Oxidative Stress may be responsible for primary infertility in varicocele patients. First, I will give you a brief introduction. Varicocele is generally defined as a problem in the venous architecture of the testes, and pathologically it is specifically the dilation of the testicular veins in the scrotum, and the outcome of this dilation in the testicular veins usually result in infertility. Statistically, or the prevalence of varicocele is around 35% in men with primary infertility, while the prevalence is raised up to 50 to 80% in men with secondary infertility. The etiology or the cause of varicocele is rooted in the anatomical differences between left and right internal spermatic veins. Absence or inability of the venous walls would result in the increase in venous blood supply, which will cause an increase in the hydrostatic pressure, causing the venous dilatation. This decline in the venous blood flow will slow the testicular circulation, resulting in a decrease in the oxygenated blood supply to the testicular tubules, which ultimately cause hypoxia, and this hypoxia would result in the oxidative stress. This hypoxia, or generally known as stagnant hypoxia, is caused by decreased blood flow and will primarily affect the spermatogenesis, as the aspermatogonia requires a very high level of oxygen for their initial mitotic cell division. In the current study, we aimed to assess the level of oxidative stress at the testicular as well as in the peripheral circulation in varicocele patients which are diagnosed with primary infertility. Over here is a diagram which shows the anatomy of the testicular venous supply, and the varicocele or the varicose veins are usually larger in size because they cannot pump the blood back to the heart. Now, for material methods, after the ethical approval from different ethical committees and the Board of Advanced Studies of the Government College University Faisalabad, and from the Institutional Review Board of Fatima Memorial College of Medicine and Dentistry, Lahore, we included 50 varicocele patients with a mean age of 32, and along with these 50 patients, we also included 10 healthy subjects which were fertile. Now, these 50 varicocele patients were clinically diagnosed as infertile. So, from these subjects, the blood samples were taken, the serum samples were taken, and the blood plasma was analyzed for testosterone, luteinizing hormone, follicle stimulating hormone, cortisol, and for total antioxidant capacity and for the total oxidative status by ELISA. Semen samples were clinically assessed for semen volume, sperm count and concentration, sperm motility and morphology, and tack and toss for the seminal plasma. Now, I will move on towards the results. So, for the endocrine picture, we saw a increase in the cortisol in the patients, while the FSH and LH levels were not very much different. The C-reactive protein were also lower, so there was no chance, or so there was no indication of any infection. The plasma testosterone levels were significantly low in these patients as compared to the healthy controls. The sperm morphology was also significantly decreased. The sperm motility percentage was also decreased. The progressive motility of the sperm in the varicocele patients were also significantly decreased as compared to the healthy controls. The sperm concentration was also found to be extremely low. Total sperm count from each ejaculate was also found to be extremely low as compared to the healthy control, and this is the main reason for the diagnosis of primary infertility. The plasma level of total antioxidant capacity were also found to be low, and the plasma concentration or the plasma levels of total oxidant status was found to be extremely high as compared to the healthy controls. The total antioxidant capacity in the semen was also found to be extremely low, significantly low as compared to the healthy controls, and total oxidative status was also found to be extremely high in the varicocele patients as compared to the healthy controls. So, with these results, uh, we believe that the hypoxia seems to be the main cause of this oxidative damage, as the testicular tissue or the seminiferous tubules require a very high level of oxygen concentration, which is required for the spermatogenesis. The endocrine profile, if we look at the LH and FSH levels, they do not differ that much, but the levels of testosterone were extremely low in varicocele patients, whereas the level of cortisols were extremely high in these varicocele patients. Now, the precursor for cortisol and testosterone is the same, that is the cholesterol, and it is likely that the Leydig cell, the steroidogenesis which is happening in the Leydig cells, has been affected by the oxidative stress. So the extra amount of cholesterol in the blood has been consumed by the adrenal gland to synthesize the cortisol, which is also known as the stress hormone. For the future outlook, there is one other important point, and that is with the testicular temperature. This hampered blood supply towards the testes also cause an increase in the testicular temperature. Now, for every degree of temperature rise in the testes, the sperm count decreases by 40%. And this low sperm count is the main cause of the male infertility. Mm, it is likely that the heat shock proteins, which are generally present in almost every somatic cell, these heat shock proteins, they get activated with a abnormally high or low temperature. So these heat shock proteins, HSP 1790, they might play a role during the process of spermatogenesis in the varicocele patients. Lastly, but not lastly, our results supports this idea that the antioxidant therapy might be helpful in these varicocele patients to recover their lost fertility. Thank you very much, and I think I have exceeded my time limit. Thank you.